My name is Alberto Giubilini and I'm a Senior Research Fellow here at the Oxford Hero Center for Practical Ethics, and I work mostly on public health ethics. So at the moment, I'm interested in understanding the disagreement around freedom restrictions in public health policy. Different people value different types of freedom differently. There is freedom from government intervention, freedom from disease, freedom from fear, freedom from risk. And the question is, which of these should be prioritized in public health policy and whose freedom should be prioritized? I don't have the answer to this question, but I'm interested in understanding what is at stake in these debates. In my article, Freedom, Disease, and Public Health Restrictions, recently published in the journal Bioethics, I have analyzed how, during the recent pandemic, different concepts of freedom have been used to support different types of pandemic policy. The same intervention can enhance our freedom in one sense, for example, freedom from the risks of the virus, but also reduce our freedom in another sense, for example, freedom from government intervention. Having a clear idea of how these different concepts of freedom are involved in a public health discussion is important, because otherwise we are not really disagreeing with each other, we are simply not understanding each other. Some people are affected more than others by the same restrictions, say lockdowns, and some people benefit more than others from the same public health goods that are promoted through those restrictions, for example, containing COVID. The problem is that these people are not necessarily the same, which raises issues around fairness in the way freedom restrictions are distributed across individuals and across groups. This is a problem that will characterize many future public health policies, from infectious disease to environmental policies, for example, restrictions on movement, to policies around individual lifestyle choices, for example, restrictions on access to alcohol, tobacco, or drugs. And this is the issue I intend to focus on in the future. I think not just philosophy, but the humanities more generally have a bigger role to play in these types of discussion than they have been given so far.